Assalamu alaikum everyone. Welcome to my channel Bahar AMJ. I'm glad that you discovered this channel and I hope that you will find my upcoming videos informative. So today we are going to discuss about why obesity is serious. I'm sure everyone knows that obesity is serious, but what I am discussing today is in detail about why and how obesity is serious. So first, starting with the basics, what is obesity? So obesity is excessive fat accumulation in our body that happens when there is an imbalance between our calorie intake to the calorie we use. If our calorie intake is more than the calorie we use on a daily basis, then it leads to excessive fat accumulation and obesity. Now, what are the causes of obesity? So causes of obesity include your inactive lifestyle, your unhealthy diet, or sometimes hormonal factors or hereditary factors. It can lead, these all are the causes. But we should understand that obesity is not confined to one cause, which means that you can't say that obesity is only happening because of this or that. Obesity is always a multifactorial thing. Mostly obesity is a combination of your unhealthy lifestyle plus your excessive calorie intake, but sometimes these two factors plus hormonal factors plus these two factors or three factors plus genetic factors, so there's always a combination of causes in obesity. But the thing that we can control in obesity is our lifestyle plus our diet. These are the modifiable factors in our obesity. Hormonal, of course, if we get treatment, that is also a modifiable thing, but your diet and your lifestyle, that's the thing that we can always control, and that's the point where we should target to control our obesity. So okay, now coming to the actual part, why obesity is serious. So before starting, this video is not to scare anyone. This video is not to just create a panic that obesity can lead to this and that things. No, this video is because it's a form of motivational video from my side, because sometimes people say that the more than the benefits, the risks benefit you or motivate you. So the risks, if I mention, maybe that will be the factor that will motivate you to live a healthy lifestyle, to make the changes in the modifiable lifestyle plus your diet. So the purpose is to motivate you. So now let's look at some complications of obesity. So the complications of obesity is diabetes mellitus type 2, stroke, heart diseases, liver disease, thyroid problem, sleep apnea, and many more. We will be discussing all these disorders part by part in the further upcoming videos, and these all complications I will be explaining them as simple as possible, so that whoever sees this video can understand what this complication actually is. So but now in this video particularly, we will be discussing about the most common, almost everyone know, the most common metabolic disorder throughout the world, that is diabetes mellitus type 2. People who are seen from India, a quick information that India is the capital of the diabetic world, which means that obesity, which is leading to diabetes, is very much prevalent in India. And obviously Indians will know why it is like that, because our eating habits are just the most common factor that leading to this all complications, obesity and everything. The layman term in India for diabetes is sugar ki bimari. But I say diabetes mellitus type 2, it is insulin receptor ki bimari. Now why am I saying this? I will explain. Insulin is a hormone that is secreted by our pancreas, which promotes the utilization of glucose, means the food we eat, to generate energy. In well-fed state, insulin binds to insulin receptors of our cell, and it promotes the entry of glucose into the cell from the blood to generate energy. So insulin shifts the blood glucose to the cells of the body. Now what happens in diabetes mellitus type 2 is that the insulin receptors become resistant to insulin, which means that they are not accepting insulin, because of which the entry of glucose into the cell is also getting affected. So there is a lot of glucose in the blood, but because of this insulin resistance, the glucose is not able to enter into the cell, because glucose entry requires insulin. So now let's talk about the features of diabetes. So what are the symptoms that we experience in diabetes is we feel excessive hunger, that is known as polyphagia. Now why is it happening? Because there is a center in our brain, the feeding center, that sends signal to the bodies whenever we have food, whenever glucose enters that center, this person has eaten food, generated energy, now it does not need more food, and entry of glucose into that center is mediated by insulin. So again, if there is insulin resistance, so the again whole problem that no insulin, no glucose, and which means that the feeding center does not receive a message that glucose has circulated in our body. So that's why it does not send a negative feedback to the body that this person does not need more food, so the person keeps feeling hungry. That is polyphagia. Then we have the polyuria, which means that we have this frequent urge of urination. Why is that? So normally glucose is never a constituent in the urine of a healthy person, but when you are diabetic, there's a lot of glucose in your blood, so this glucose is filtered by your kidneys, and when glucose enters kidney, so this glucose also draws with it a lot of water. So that's why you have this frequent urge of urination, because you are losing a lot of water. Then because you are losing a lot of water, which means that you have excessive thirst, so that's this feature is known as polydipsia. So the three common features is polyphagia, polyuria, and polydipsia. So I think the people who are diabetic now, they know that why are they experiencing these three common symptoms, that is the excessive thirst, excessive hunger, and too much urination. And people who are not diabetic, I mean, they don't know that they are diabetic, they are in obese category and they are experiencing these symptoms, then at the very first they should get their blood glucose levels checked. And I have put this table about the diabetic and pre-diabetic blood glucose levels. And obviously, if you are in the pre-diabetic or diabetic stage, immediately consult a doctor. Diabetes should be managed at an early level, because long-standing diabetes can lead to many other complications. Now let's not get into that, because our topic is obesity and its complications, not diabetes and its complications. Now this one problem of obesity, it is leading to diabetes, and diabetes itself is a very big problem. So if we manage obesity at the very first level, we will not progress to this complication, and diabetes is not the only complication. In this video I'm discussing about diabetes, but in the upcoming videos I'll be also discussing about the other complications. So prevention is better than cure if you are not in an obese category, so be thankful for that and be mindful of your lifestyle, of your eating habits. And if you are in an obese category, and alhamdulillah, if you don't have any problems, so you have a very good chance revert your obesity. Even if you get the complications, you should revert your obesity, because reverting obesity itself can manage a lot of conditions even if you have developed them. And this thing, I guess everyone knows that in India especially, that if there is always everywhere sweets, like every occasion you have something sweet to eat. And even if there's no occasion, sweet is a very very integral or very close part in diet of the Indian people. So this sweet is the major enemy. This sweet is the most unwanted thing that our body needs. It does not give any nutritional benefits to us, but it can cause a lot of problems. So in lifestyle modification, and particularly if you don't want to go into the obese category, so the basic thing and the most important thing that you should do is just cut down all the sugar from your diet, because sugar, as I said, that's the root cause of many problems, especially in India. And there is also, and I guess all across the world, that there is this custom tradition that if there is anything good, if you're going to a party or if you're going just to get together, just go with some sweets. But I feel that this giving sweet tradition is very something that I don't understand particularly, because it's not like, you're showing your love or concern by giving sweets. I say that you are just gifting a person sugar ki bimari by giving sweets. So we should be mindful in that cause also, that we don't consume sugar, plus we don't make others consume sugar. Be healthy and let be others healthy. So obesity, it is not only a problem that we see in adults, it is also a very big problem that we also see in children are indulging in excessive eating, sedentary lifestyle, and children are also developing obesity at a very young age. That's very alarming. Again, the same cause that children gets a lot of sweets, get a lot of junk. So parents usually believe that giving children sweets, junk. Okay, so sorry for the inconvenience. So I was at obesity of children. Children are developing obesity at a very young age, that is progressing to diabetes at very young age, and it's a very big matter of concern. So be mindful of what the child eats also, because allowing the child to eat anything is not showing love. It's just spoiling the kid investment for future problems. So children having good diet is the base or the foundation for the rest of the life. So children having a good diet is also very important. So this was all about the video. I hope that you found this video informative, and just take a pause and think that if I don't want these complications in the future, if I don't want diabetes, liver diseases, thyroid diseases, all the complications that I mentioned, so maybe this is the step that you should take some serious measures for controlling your obesity. So I would also like to share sunnat of our beloved Prophet Muhammad sallallahu alaihi wasallam, that whenever we eat food, we should always fill 1/3 of our stomach with food, 1/3 with water, and 1/3 we should keep empty. Which means that we should never eat to an extent we are feeling very heavy or we are feeling very full. So that's healthy way of eating from the sunnahs. So inshallah, very soon my next video we will discuss about how obesity leads to heart diseases and stroke. So if you found this video informative, please do like, share and subscribe. Inshallah, I'll come with a new video about the part 2 of complications of obesity very soon.